Namaskar, welcome to Institute of Brain and Spine. We'll discuss about spine surgeries. Do somebody at all need a spine surgery? Because sometimes people come to us with MRI films where there is a disc bulge, a small disc bulge, sometimes with a large disc bulge, and they ask us question, do I need surgery? So how you can know when you need a spine surgery? Not all patient need spine surgery. It is not at all required. It is required in a very rare condition. I mention it again. It is required in a very rare occasions where the pain is so severe. I am adding the word so severe. It's not just severe. It is very severe. When you are not able to tolerate the pain, you tried medication, physiotherapy. I'm telling you, medical conservative management works very well if you do proper posture correction, do proper physiotherapy. I repeat physiotherapy. Then all maximum number of, I believe, near to all pain will be relieved. So when it is needed, आपण ଜାଣିପାରିବେ when it is needed. When it is needed, when the pain is uncontrolled. If you try physiotherapy medication and pain does not get you do not get rid of the pain continues, and you have to take leave from the office. You cannot stand or sit, you cannot even walk, your day to day life is hampered for a long period of time. You have taken medication for long, you're trying physiotherapy long means minimum 3 to 6 months. If it does not recover, then we give you an option of surgery. Now with the safer alternatives, the surgeries have become very safe. But still, if you do not experience any pain in spite of having a disc, sometimes people, you may have a large disc in the MRI, but there is no pain. You don't need surgery. Large disc in the spine, no pain, no surgery. There should be pain for surgery. There should be severe pain for surgery. If you don't have this, we don't need surgery. Second thing is, if you have a fracture in the spine and it is very painful, even a fracture which is not painful does not need surgery. Third thing is a claudication. When you cannot walk more than, this is especially for elderly population, when you cannot walk for more than 100 or 200 meters, or when your age is more than 50, you cannot stand for more than 10 minutes, then you may need surgery. But surgery is always an option. Do not, and chances of having a disc causing paralysis also very rare, but only in the cases where you have a cervical compression or you have very symptomatic, means you have so many symptoms of the problem, then only you need surgery, otherwise you don't need surgery. So whenever by seeing a MRI, don't get confused, you need surgery. If you have a disc also, if you don't have pain, you don't need surgery. That's the message. Thank you.